Hi, all. Mr. Midwife here. So let's talk about something that's a little more serious today: postpartum blues, postpartum depression, and postpartum psychosis. Disclaimer: nothing about it, of what I'm about to say here can be considered medical advice. It is strictly my opinions and my experiences. Trigger warning: if you're not quite in a space to hear about this right now, by all means, come back and listen to it later. So, you've had your baby, and things are going okay. Things are going good. You're sore, you're a little bit tired, but things are going okay. And then you start to get to the point where you don't want to take care of your baby. You're maybe upset with your husband quite a bit. You don't want to attend to the other members of your household. You just don't want to get out of the bed in the morning. You're sad. And then a few days later, you feel better. You're back to being your normal self, and life is good again. That is postpartum blues. It can happen up to 2 weeks, inside of 2 weeks of having delivered your baby. I don't want to say it's normal, but it happens. Now, postpartum depression are those same feelings that carry on beyond 2 weeks. So you're 2.5 weeks into this, and you still don't want to interact with your baby. You're still having a really hard time getting out of bed. You're still crying all the time. You don't want to attend to the other members of your family. You don't want to feed your baby. You don't want to change a diaper. You're angry at your husband for no particular reason at all. This is postpartum depression. Postpartum depression can present itself up to 1 year after you've delivered your baby. So at 6 months, you're doing good. At 9 months, you're doing good. At 11 and a half months, you start feeling really terrible. You start feeling sad. And again, you don't want to attend to your baby. You don't want to feed your baby. You're angry at the other members of your household for no particular reason at all. This is all postpartum depression. Who's at most risk for postpartum depression? Those who have had postpartum depression in the past, and those who have had depression before they got pregnant. Those folks, you ladies, are set up for postpartum depression. Now, just in the last couple of months, I've had several of my returning moms come back to me after they've had their baby, and I walk in the room, they're sitting on the exam table, and I plop down that little wheelie stool that everybody sits on, and I say, "So, how are things going?" And their face falls into their hands, and the tears just start flowing. I don't want to have anything to do with my baby. I'm so sad all the time. I'm not eating. I don't want to get out of bed in the morning. I'm angry at my husband for no particular reason at all. He hasn't done anything wrong. And the more she talks, the more I discern the fact that this is postpartum depression. Now, the good thing is we can do something about it. A simple antidepressant works wonders in these cases. Now, I explain it to my patients this way. If you had a cold or the flu, you would be in bed for a couple of days, some medications, some rest, and within 2 or 3 days, you're going to feel better and you'll be back to yourself. Postpartum depression is a lot like your brain catching a cold or catching the flu. It's a real thing. It really happens. You're not going crazy. You're not a bad mom. Your brain has got a cold. And what you need is rest and medication. And you need help. There's nothing wrong with that. Sometimes there's a stigma in the United States these days with depression, though that stigma seems to be slipping away. There's a stigma with depression, particularly postpartum depression, that if I feel this way, I'm a bad mom or a bad person or a bad parent. The furthest thing from the truth. Your hormones are playing tricks on your brain. Your brain has got a cold. You need rest, you need some medication, and you need a little help. There's nothing wrong with that. So again, what does it look like? It looks like sadness, like any other depression does. I don't want to take care of my baby. I don't want to feed my baby. I'm angry at my kids and my husband for no particular reason at all. I'm just not myself. I'm just not myself. if you're having those feelings, if you're having those sensations, if that's what you're feeling, please, I implore you, please come get help. Go to the nurse emergency room. Go back to see your doctor. Tell somebody what you're feeling. Get some help. We can do something about this. And then the other thing is postpartum psychosis. Postpartum psychosis, that's another level beyond depression. When you're hearing voices, you're having thoughts of harming yourself or harming your baby, harming another family member. Your thoughts are erratic. You just can't hold a thought in your head. That can be postpartum psychosis. Again, you need help. Your brain is sick. You have a cold or the flu. Your hormones are playing tricks on your mind. There's nothing to be ashamed of. It's nothing to be afraid of. Just get some help. Go to the nearest emergency room. Come see your doctor in the office. Now, I want to speak to the family members here for just a moment. Sometimes, Dad, Mom won't recognize what she's going through. She won't recognize that she's depressed or having strange thoughts, but you will. Sometimes, Dad, you notice it. Sometimes her mom notices it. Sometimes her sister notices it. Sometimes Grandpa notices it. Some other family member, maybe even a neighbor, notices that she's acting strange, even though she doesn't think she is. Again, there's no stigma. She's not crazy. She's not a bad person. Her brain has got a cold. The hormones are playing tricks on her. She needs help. Get her in to see the doctor. Take her to the nearest emergency room. Do something. Reach out. Help. It's going to take a little bit of understanding on your part, some rest for her, and some medication. And in time, you'll have your loved one back. I promise. Anyway, bottom line, the stigma around these things is falling. Let me assure you, it is real. Again, your brain has got a cold. You need a little bit of rest and some medication. We can do something about this. Come see us. Come get help. That's all I have for today. See you later.